welcome to our conversation. Today, I am with Dr. Ziberi and Dr. Mihaela. First of all, Dr. Ziberi is in Macedonia and Dr. Mihaela is from Romania, but they are together to talk about an exciting potential project. Welcome to the show.
Thank you very much.
Thank you for your invitation.
Yeah, and for the sake of our viewers, could you please tell us about yourselves a little bit and what you do? Starting with Dr. Ziberi.
Okay, my name is Bashkim Ziberi. I'm a professor of physics and medical physics at the University of Tetova, and I'm a Fulbright alumni from the Harvard Medical School, and I'm pretty much in the last years involved also in the field of global health catalyst, and that is how we are part of the big network that we got introduced at the Harvard Medical School and now still working together with our partners from US, Europe, Africa, Southeast Asia. The main point is, of course, to increase the quality for cancer treatment also in our region in Southeast Europe, because we identify similar difficulties related to cancer care compared to more developed countries. And the idea is, of course, to fight the disparities between developed and low and middle income countries. And we identified a lot of practices, experiences from other areas and from experts that are trying to help us, and we are working together in this direction.
My name is Mihaela Udristiolu. I'm a lecturer into the framework of the Department of Physics, Faculty of Sciences, University of Craiova. I'm a Fulbright alumni too. I spent a half year at Georgia Southern University in Georgia. My collaboration with Global Health Catalyst started last year in April, when I participated to the last summit from Philadelphia. I believe that our focus is on increasing the quality of the treatment for the benefit of oncological patients. We believe that it's important, very important to understand that the focus is not on medical physics, is on oncological patients, their needs. We can do this using our expertise in medical physics and increasing the quality of the training that we deliver to our students. We are together here to write some proposals, some applications in different European projects, because it's important to have resources, material resources, to evolve in our field. We found common needs, and from this point of view, we collaborate, trying to sketch different activities, different results that we can include in those European projects. I believe also that it's important to develop our network, adding other universities with the same needs from our area. And I believe that we will succeed because we have plan A, plan B, plan C.
Yeah, sorry, I didn't mean to cut you short. But yeah, it goes without saying that seeing the two of you from two different countries, Macedonia and Romania, in the room together right now to discuss this project, the first question I have to ask is, what inspired you to come together to work on this project?
Well, Global Health Catalyst. That is how we got introduced to each other. We got introduced to each other this year in April in Philadelphia during the Global Health Catalyst Summit. And, one of the main mottos of the GHC is connecting. And that's how we got connected. And of course, then after that, we just followed up with intensive communication between. In the meantime, we used the mobility programs of the European Union. We signed an agreement between our departments, our faculties, And now, through that mobility program, Mihaela is staying at our university for 1 week. Since Monday, she's here. And it is how we came together now, and we are intensifying, increasing the collaboration further, as Mihaela said, through specific projects that we want to apply together, of course, with the expertise of the experts from Global Health Catalyst and Global Oncology University.
And
Well,
moreover, we want to show that we are not only talking about this subject, we act together, plan together to change something in our countries. It's very important to have action, not only to talk about.
that is, that is perfect way to put it, because I mean, GX is about the win-win collaborations with impact, obviously. But which brings me back to your project. Like, what is the common need you had for your countries that made you come together to work on this specific project around training? I didn't want to get into the project itself, but whatever you can tell us, like, what inspired you to just focus on that specific project? What was the common need?
The education is very important for our students because the power of education is huge. And we don't want to change only what's happened tomorrow. We want to change things on long term with benefits for students, for faculty, for patients, because they are the most important in this equation. And we are inspired by some leaders from Global Health Catalyst that put a lot of energy to develop different projects, not only in eastern part from Europe, but in Africa too, and in Asia, I think. Yeah. We are here to collaborate because this is what we believe that is necessary, to collaborate, to write together these applications, and of course to implement them in our region.
And that's maybe if I can add is that, for example, in the region for the moment, to be more specific, is that we don't have a master program in medical physics with residency. So we have master programs in physics, medical physics, but without a residency program. So that is one point where we are working together now with our experts and partners internationally to try to develop this program also in the region. And the other thing is the quality of treatment, especially when it comes to medical physicists, but also to oncologists in general, but especially to medical physicists, but because the role of medical physicists is not really recognized in the region, the importance of it working in clinical hospitals, especially in radiology and oncology departments.
Right. So, I mean, it's important that you talk about, education and especially specific to medical physics. So what impacts do you hope to have in your respective countries and collaboratively in the region?
We expect to develop master programs in our countries. And after this, we hope to develop a residency program. The impact is huge because this means clinical practice for our students that makes the difference between a person that can kill people and the person that can cure patients. It's very important, this detail.
There are studies for the moment for the European countries specifically. There is a big gap between lives saved in Western European countries and those in the Southeastern European country. This discrepancy in death and or life saving, we want to decrease it between these countries, and this can be decreased only by qualitative treatment of patients. It's not only about having machines. We have enough, in some countries in the region, we have enough radiation machines for patients compared to the number of the population. But again, the number of mortality compared to the Western Europe is higher than in Western Europe. And this discrepancy we can bridge only by having a qualitative treatment. And one of the points is, of course, if you have well-trained oncologists, medical nurses, and medical physicists. And for this, of course, we want to use the platform that we already have. It's given there. It's a Global Oncology University that's already doing a lot of training. And also now we are working on in terms of having degree programs in Global Oncology University. And we want to use this huge platform of experts that have a lot of experience in the field of training, teaching, and bridging this disparity to help that we are doing better also in the region.
Absolutely. It looks like Dr. Mihaela wanted to say something.
I want to add only one thing, that we want international recognition for the quality of our graduates. They should prove that they are capable to handle this expensive equipment, and they work safely with ionization radiation. They know to make the quality assurance for the equipment and for the treatment plan. So to work to the highest level possible for the benefit of oncological patients.
Right. So in terms of the next steps, without getting into the details, the nitty-gritties, like what are you looking forward to in this collaboration?
We hope to have an exchange between universities, student mobilities, faculty mobilities. Also, we want to collaborate in different projects together with Global Health Catalyst to bring their expertise here in southeastern part of Europe. Also, we want to involve vendors. We want to involve the professional associations in our effort. They are important actors that bring added value to the process of education. This is what I believe.
Yeah, this what Mihaela said, it's already thrown in paper. So we have now a specific target about incoming calls now from the European Union for projects. We have identified 2 projects that we are working now specifically to apply in this project. We know the deadlines, so probably at the beginning of next year, we hope to pass the evaluation procedure. So we are on a good way to let's say to expand and to have funding so that we can follow the project in the region.
Well, we are rooting for you with all our hearts, and we cannot wait to hear back from you, in a few months about the status of the project, or even before that, who knows. But is there anything else we haven't talked about that you'd like to say before we wrap up this interview?
Yeah, I would like to express our gratitude for the support given by Global Health Catalyst and their help regarding their platform that use for our training, for student support, for all these things that make the difference between success and insuccess.
I mean, connecting people is very important. Networking is very important, and the weekly meetings that we have, online meetings that we have with colleagues all over the world, but especially from US, from Global Health Catalyst and Global Oncology University are very important for us to help us to identify points where we can collaborate and points where we can apply in different projects, and also to identify the possible weakness that we may have in the project now that the project have the best. So every week we have a meeting in a particular time. So today we had a meeting before this interview, and it's really helpful for us to continue on a continuous basis to have this conversation in order that to keep up at least the good spirit of doing good things to help save lives. And at the end, one of the biggest supporters, of course, are you, Vivian. It's amazing the advocacy that you are doing. I'm following up on the social media on all directions I can about your work, and it's really, we need such kind of people. Otherwise, it's difficult to get this, let's say, not advertisement, but to be in public so that everyone can see and try then tomorrow to help us as much as they can in this, let's say, mission that we are working all together.
And we want to involve you. And we want to involve you in our projects because it's important to spread good examples. Think that other people need the same things, and if we are a good example for them, things might be changed in that place from the world.
Yeah, well, it's truly an honor to work with you all to amplify the work that you're doing for the rest of the community, because that is how the rest of the world can know that there's a lot of work to be done, but there are also people who are willing to put in the work. And so we're here for you. I'm here for you anytime that you need or you not need me, but anytime I can support in any way. You have my contacts, but also, I wanted to first of all congratulate you on coming together to even start discussing how you can support your countries and support Eastern Europe in improving the capacity. Thank you for your service to humanity, and I look forward to speaking with you again anytime soon.
Thank you very much, Vivian. Thank you.
And to our viewers, thank you for watching. Till next time.